Good afternoon, everybody. Thank you so much for joining us for our COVID-19 Grand Rounds. Today featuring voices and experiences on the vaccine frontlines with guests from Erie Family Health Center. We're so excited to have them here. We're so excited to see you all filing in. I think this is going to be our best attended Grand Rounds ever since we started doing these in the fall. So thank you so much for being here. Let me tell you about our next Grand Rounds. Just want to give a little plug, and I'll drop the URL into the chat so you don't have to copy that down or try to type it in. But we're looking forward to this Grand Rounds as well in a couple of weeks, which is going to be featuring Kaita Mutefa, who has been part of the Moderna clinical trial testing their vaccine, which of course, as you know, is ongoing, and she's going to be talking about her experiences in that, and then relating it to medical mistrust and consent and the clinical trial process. So I think that's going to be super exciting. Now, with that said, I'm going to stop sharing my screen so we can see all of your beautiful faces. We're going to encourage people to be on video if you would like. While we're doing this call today, you can leave comments and questions in the chat. And you're also will be free to go off mute and ask your question verbally. There are no slides today. Woohoo! This is just a conversation that I'm going to be moderating with my colleague at Erie. Do you want to say hello, Bridget?
Hi everyone, Bridget Magner from Erie Family Health Centers. So excited to be with you all today and looking forward to a great discussion.
Thank you, Bridget. So before we get started, we're going to do something that I've sort of just learned, and it's kind of fun. This is the afternoon, potentially the afternoon slump after we've all eaten. And we want to have a really dynamic QA and conversation with our guests from Erie today. So what we're going to do is a Zoom storm. And so what that is I'm going to ask a question. I'm going to ask you to type it into the chat and hold off on hitting send. So I'm going to ask you the question, you're going to put it in the chat. You're not going to hit send until I say go. And then when I say go, it'll be a Zoom storm. There'll be tons and tons of amazing content and feedback that all hits you at once. So does that make sense? Does it sound like amazingly fun? Yes and yes. So here's the question. Remember, do not hit send until I tell you. Your favorite thing about the weather we're having right now. Your favorite thing about the weather we're having right now. And yes, you have to find a favorite thing. So I'm looking at people's faces. I'm seeing some typing. I'm seeing people who look pretty satisfied with their answers. So when I count to three, on a count of three, we're gonna all hit enter. So we'll have our Zoom storm on a count of 1, 2, 3. Yikes. I see fluffy, I see snow, pretty white snow, boats. That's interesting. I'll have to follow up on the boats. Maybe boats are out there somewhere, being in a snow globe. That's fantastic. Hot cocoa, endless cups of tea, no bugs. I've been watching Ozark lately, and it's so interesting that you never see them batting off mosquitoes in Ozark. I don't know if anyone else has watched it, but there's never any mosquitoes there. It doesn't make any sense. Anyhow, I digress. Thank you all for being here. I think we're properly warmed up. So I'm going to just tell you how we're going to manage this. Bridget and I are going to co-moderate and kind of take turns asking questions. We have questions prepared, and the panel is prepared with their answers and their thoughts on these questions, but we definitely want to hear from you. We definitely want this to be something that's meaningful to you as a person, as an individual, maybe questions you might have that your family has, or questions that might come up with the clients and people you're serving in community. So keep all that in mind. You can ask again in the chat or verbally. We'll take pauses and make sure we can have a lot of interaction. And I'm gonna now turn it over to Bridget, who will go through and have each of our Erie team members give a quick intro and tell us who they are.
Great. So to start, we're going to be introducing your name, your role, and why you are here today. So can we start with Nicole?
Yes. So my name is Nicole Martin, and I am one of the coordinators over with our Lending Hands for Life program. And so one of the reasons why I'm here is for a very long time, or not for a very long time, we've only been in this pandemic, what, a year now? But since kind of like all of the talk around vaccines has first started and kind of seeing the disparities that kind of exist and like the amount of people who are nervous and hesitant about it, I really wanted to do my part to kind of do as much talking about the vaccine and why I decided to get the vaccine, just in case it helps anyone who may be watching.
Thank you. And Alex.
My name is Alex Cortez at Erie Family Health Center. So I'm a community healthcare worker. Pronouns he, him, and his. And I pretty much wanted to join in the conversation and see people's experiences with the vaccine and why, as well as share mine. So yeah, we'll delve into that soon enough.
Thank you. Shira.
Hi, good afternoon, everyone. My name is Shira Dunn. I'm the Director of Population Health at Erie. I'm here because I decided to get the vaccine and I'm 8 months pregnant, which you cannot tell on Zoom. So I know that is potentially a controversial stance, and I think maybe sharing my experience could be helpful for others.
Thanks, Shira. And Carell.
Hi, everyone. Good afternoon. My name is Carell Webb. I work at Erie. I'm a nurse and the manager of workforce safety and compliance at Erie. Bridget refers to me as one of our content experts at COVID-19 at Erie. So I've worked with our infection control team to give our staff all the most up-to-date information on COVID vaccination. And we have really done an incredible job with our overall staff COVID vaccination rates. I'm really proud of it and really hope to bring information on the COVID vaccine to this group and also share my personal experience with vaccination as well.
Awesome. So thank you so much. And again, thank you to all the Erie folks who have come together today. Erie is definitely taking a major lead in vaccinations in Chicago, and I think we can learn a lot from them, both how they're doing it as an institution, but even probably more importantly, just people's personal experiences. I think the personal stories are always things that just really resonate with folks. So we're going to open it up to our first question and ask you each to speak briefly about what your initial thoughts or feelings were about getting the vaccine. And to make it easy, I'm going to just pick on people, so you're going to have to wait for me to call on you, but I'm going to start with Nicole.
Yes, that's 2 times in a row. Not that I'm counting, but just throwing it out there.
Okay, we'll try to lay off on you a little bit. Sorry about that.
But yes, initially when the vaccine first came out, initially I was a little bit far removed from it because in my head I was like, this isn't going to roll out until the summer. Really isn't anything for me to think about. And so I wasn't really too worried about it until I was having conversations with my supervisor and Erie's talking about rolling out the vaccine to staff. And then it was kind of like a big, wait a minute, I didn't look into this. I don't know what it's about. And I feel like at that point, everything that I kind of understood about the vaccine is really what I pulled from social media, which I'm sure you all know at this point is a terrible idea. Because one of the first things I saw with the vaccine was information on Bell's palsy. And I was like, wait, I don't want that to happen. But then I had to Google it because I honestly didn't know what that was. I was just kind of listening to social media. And I kind of, once the vaccine was kind of rolling out to Erie staff, really, I had to go back and do my own research to kind of see it and really acknowledge what about it was making me uncomfortable. Where was my hesitation coming from? Was it because I thought it was coming out too fast? Was I concerned about the ingredients that were in the vaccine? Which kind of all really kind of led into my decision to eventually getting it. But initially I was very removed at first and also incredibly hesitant just because of everything that I heard on social media. But I will actually second what Carell has said earlier. Carell in Erie themselves have been incredibly instrumental with really distributing that information on vaccines to the staff to really get me to a point where I was able to feel comfortable with getting it.
Thank you. And we'll get back to asking everyone about what you kind of did in terms of your own research, your own exploration. So we'll get to that question for all the folks. But since you named her, I'm going to now go to Carell. And Carell, tell us your thoughts. We know you're an expert on the vaccine and you're a nurse, but is there any difference in terms of when you yourself are taking the vaccine? Were there thoughts or feelings that you had as you were contemplating taking the vaccine for yourself?
Sure, this is actually one of my favorite questions because I myself, how heavily this process has been politicized has been very challenging. The way that we've politicized public health measures of mask wearing, hand washing, social distancing. It's been really challenging as someone who works in public health, as a nurse, to really balance the public good that these measures will do versus how much it's been politicized in the media. I myself, when I heard about the vaccine coming down the pike, I was incredibly excited. I've spoken to almost every single employee who's been excluded from work for COVID-like illness since March of 2020. And that was the most meaningful way for me to really understand how life-saving this vaccine could be. We have fortunately not lost any of our staff to COVID-19, but there were many employees who I spoke with who were sick for weeks with COVID-19, and calling them every few days, checking in on them, talking about their experiences with their family. To be able to have a way to cut through the trauma of COVID-19 for our staff and then the inevitable impact it will have on our patients. There was a lot of excitement that I had, but I also knew it was so important for me to do my research because my research, along with my other infection control team members, would help to inform members of our Erie staff and inevitably our patients. So then it was just buckling down, going to the CDC, NIH, FDA to really understand the interesting parts of the vaccine, how it was different from other vaccines that we know, such as MMR, varicella, kind of getting into those scientific details, and then doing my own campaign with my own family as well and friends.
Thank you. I'm going to just ask a quick follow-up, and just for a reminder for everyone in the Zoom today, the vaccines that we have available, what exactly do they do? Are they preventing infection? Are they preventing illness? If you can, I think there's a lot of confusion about what they're doing. So if you can just make clear what the vaccines actually do and don't do.
Sure, that's a great question, Jim. So the two currently EUA approved vaccines by the FDA are made by Pfizer, which is a pharmaceutical company, and Moderna, which is a biotechnology company. These two vaccines that are currently approved under emergency use authorization, and I say that specifically because we may have some other vaccine candidates that are coming down the pike towards approval in the next few weeks and months. These vaccines are 94 to 95% effective in preventing COVID-19 infection. So while there is a small chance that you could be infected, what it also does is likely significantly reduces the severity of illness. So persons, if they were to still be infected with COVID-19 with a small chance, because it's not 100% effective, and no vaccines are 100% effective, that high efficacy does provide a very wide and strong protection. And for those who were to maybe be infected, would likely have a very significantly reduced case of COVID-19 with very few symptoms and very unlikely to be hospitalized or die from COVID-19 infection.
Thank you. That's beautiful. So the key thing is the vaccines greatly reduce mild, moderate, and serious disease. It may have an impact on actual infection or transmission. We don't exactly know, but it's a huge win that these vaccines keep people out of the hospital, keep people from dying. And if they do have some sort of illness that comes from a COVID infection, it's mild. So thank you for that. I'm going to go to Alex on your thoughts and feelings when you were thinking about getting vaccinated.
Yeah, I pretty much second everybody, but again, I had some friends of mine who had vaccine, even some extended family members who had the COVID. They recovered pretty well. One of them is around my age. Um, she did lose her sense of smell, which I don't believe she has regained yet. So it was just like a toss up, like who gets these symptoms and like the severity. So, when they were just releasing it out in the media that they were going to come out with these vaccines, and then they were discussing like how rapid it was formulated, and they kind of backed it up with some kind of reasonable science, which was like, they were using some of the uh, formulas from SARS vaccine, flu vaccine, stuff that we've already kind of injected in our bodies already. And yeah, and they were, giving it to healthcare providers, the whole healthcare industry. So then I kind of just took it from there. I was like, well, that seems pretty uh, effective. Why not just get it done? And then when we had a webinar that Carell hosted, thank you for that. And it really explained how it breaks down in your body, or how it kind of reads the vaccine, that it's not an actual vaccine, it's just like a copy of it, if I'm not mistaken. And yeah, and took the second dose. And should I describe my symptoms yet or not yet?
You are ahead of the game, but we are going to ask about the first and the second dose. And thank you for bringing up a couple of things. And I see there's some, Carell has just dropped something into the chat about the vaccines. So the two that are currently available are mRNA. And what that basically is, it's a messenger RNA vaccine. It does not stay in your body. It goes in, it basically tells your cell, look out for COVID, and then it disappears. It kind of disintegrates. So it doesn't impact your DNA, and it does not contain, the vaccines contain no virus, no live or dead, no kind of virus at all. And one of the reasons why you mentioned things were done really fast, I've been kind of doing research advocacy for decades, but the speed of this really freaked me out. And calling it warp speed, it did not engender confidence in me. I was really like, what the hell? This can't be real. But part of it is that the mRNA platform has been researched in the HIV space for decades. Haven't been able to really utilize it yet. We don't have an effective HIV vaccine yet, because HIV is a much tougher cookie to crumble, essentially. But all the work that was done in the HIV space on mRNA made it kind of ready for prime time. And then you also brought up our knowledge of other kind of viruses and flus and SARS and things, and other coronaviruses. All of that coupled with all the resources globally put together at the same time, building off of what we already knew, an enormous focus and enormous effort was a big reason why we were able to get these so quickly. So I'm glad you brought those things up. And I'm gonna now take it to Shira to talk about, what were you thinking in terms of, you're thinking about taking a vaccine for yourself, but you're also pregnant. And we know pregnant women haven't been actually in the clinical trials. So what were your thoughts and feelings about taking a vaccine for yourself?
Yeah, so when I first heard that the vaccines were approved, but that no research had been done with pregnant women, I definitely felt a little hesitant, but I also didn't know when it might become available to me and whether it would be during my pregnancy. And so, I tried to do some research to understand what this vaccine does. And just as background, I have a background in some vaccine promotion work. And so I typically am pretty pro-vaccine as a person in my personal kind of views and in my work. But because there had been no research, that definitely gave me a moment of pause. And so once it became clear that this might become available to me sooner rather than later, I really didn't think I would get it before having my baby. But once it became clear that I would be offered it, I just started to think really hard about what was my gut. What did my gut to say was probably the lower risk option as far as getting COVID and all of the negative outcomes I've been reading about for pregnant women who do get COVID and how much more likely they are to be very sick versus getting the vaccine, which in theory should be very low risk according to my provider, as well as other people I know that have expertise, either they work with pregnant women or in the vaccine world. So I had an initial hesitancy, but I came around pretty quickly to the view that if I was offered it, I would definitely get it. That was sort of my working mental state. And then when it did become available, I just had to kind of check myself and make sure I wanted to do that, but I moved forward pretty quickly.
Awesome. Thank you for all for those great dialogues so far. I'm going to turn it over to Bridget to take us through the next set of questions.
Great. So you all shared a little bit about some of the research that you did that went into your decision making, and you all have received both doses of the vaccine. I'm really curious if you can describe a little bit more of your process. What did your research look like? Who did you talk to? And when did you ultimately make your decision? Let's start with Karel.
So my research was pretty methodical. My counterparts and I dug into the clinical trial data to really understand how participants in the clinical trial felt after their first and second doses. And that was really important to be able to prepare our staff and that transparency. So when we were doing education for our staff, we were very clear that we know that the second dose, you will likely have more side effects than the first. We saw this in the clinical trial data, and we're letting you know before we even give you your first dose that this is what we expect. And we actually have a plan for what we're going to do for staff members who get their second dose and are working on site and are having these side effects. Do we think it could be something else? How are we going to kind of triage the situation? So digging into the clinical trial data, I think my own perception of this is slightly skewed because it's really my role to be able to break down this information. But one thing I know about myself is I can really understand something when I can teach it to someone else. So really going into the clinical trial data, looking at all the explanations of the clinical considerations from the CDC, understanding who was in the clinical trials. Was it racially and ethnically diverse? Was there gender diversity? Was there diversity in occupation? All of these different things really went into my decision making to really understand as much as I could about these vaccines. And I think there was a second part to your question, Bridget, as well. I wonder if I missed it.
Just really, when did you decide, and what about your process helped you reach your decision?
I remember seeing a picture of a Black woman in a white lab coat with Dr. Fauci and some other viral researchers in March of 2020. I did not know who this woman was, but I vividly remember this picture, mostly because I saw a Black woman in that picture wearing the lab coat and clearly a part of the decision making. Fast forward a few months later, I learned, as someone just put in the chat, Kizzy Corbett, she is a viral immunologist and was incredibly instrumental in the actual development of this COVID vaccines. And being able to see someone who looks like me in the vaccine development process, I don't even think I really understood how much that meant to me as someone who really works to understand the actual process of vaccine development, and to be able to put together the understanding of how this process was faster than we've ever seen, as Jim mentioned. That was probably my biggest stopgap, was if it took 4 years before, how did it take a year now? And finding the logistics of the fact that we produced millions of vaccines while we were conducting clinical trials with the hope that some of them would do very well, and not really knowing, but taking the gamble, because if we went through these clinical trials and the Moderna and Pfizer data was great, and it would take millions, we need to produce millions of vaccine doses, and that would take months. Understanding the public health crisis that would be, and understanding why we had to do those things together, really put it all together for me. So really understanding the vaccine development process is really important. Seeing someone who looked like me in the vaccine development process was also really important as well.
Carell, I love that. I think that's really important. All of the data and science that you researched, and then also just that striking image of who was involved and that personal connection as well. So thank you. Alex, can you describe how you reached your decision, who you talked to, what your research looked like?
Yeah, like I did my research. I would keep up with the news, the CNN, and yeah, there was like an abundance of volunteers from all walks of life. So that kind of helped with my decision as well, you know, because the numbers is really what matters. So there was like enough data from like a big group of people, then that automatically, and then they don't see like there's no deaths, just minor, you know, symptoms, side effects. That already like sold me there. But yeah, I just decided to take a chance. You know, I was already kind of taking a chance by being outside, and you know, so might as well like get a vaccine in me to help me with the. Now, Carell, you said that it's 99% from not infection, like to not get infected.
So I think, go ahead, Carell.
The efficacy for the Moderna vaccine is around 94.5%, and Pfizer is 95%. So whenever you have two of anything, there's always a question, is one better than the other? And most importantly, the efficacy between these two vaccines are very similar, which is great.
Yeah, okay.
Great.
For,
go ahead, Alex.
And it's for the infection rate, as in that percentage is for you not to get infected. I know that the vaccine itself prevents you from getting the symptoms or just the disease, like of any cold and stuff. Sorry, one.
So it's just, there is a difference. So again, it's important to know that the vaccines prevent serious illness. We do not know at the moment if they prevent infection. The studies are still ongoing though. So the longer people are in these trials and giving data, the more time in the studies, we may be able to determine whether these vaccines prevent actual infection. At the moment, we don't know if they prevent actual infection, and we don't know if they prevent onward transmission. So you being vaccinated means you could get infected. You may not get sick at all. The likelihood of you getting sick is very, very low. But you could actually possibly transmit it without knowing you have it at all, because you're not going to likely get sick with the vaccine, which is why we're still recommending on the public health level that we're masking, distancing, washing our hands. That said, as the clinical trials move on and the people who are in the Moderna study and the Pfizer study continue to be followed up, we may be able to make the determination with science and data that shows us, yes, these vaccines not only reduce or get rid of the serious illness, but could also prevent actual infection.
Thanks, Jim. Shira, will you share a little bit about your research and how you ultimately made your decision, who you talked to, the varying opinions you heard?
Yes. So I talked to my midwife because I wanted to understand their perspective on whether this was a smart thing to do. They did not tell me one way or another. They shared with me a lot of research, which was helpful, that in theory, this should be very low risk. And I needed to weigh whether I felt like it was higher risk to get COVID versus the vaccine. I also have a very good friend who is a midwife in New York City. And so I was able to talk to her and get her perspective. And she had also been vaccinated. And so just to understand what her personal experience had been, whether she, as a friend, would recommend that, because I think that's very different than as a provider. And she shared with me some of her colleagues who were pregnant and had gotten vaccinated and what their perspectives were and why they had gotten vaccinated. I also I thought that the information that Carell and our joint supervisor shared were extremely helpful for the agency. It really helped, you know, explain a lot of, what Carell said as far as why this was so fast and how it didn't decrease the evidence supporting the efficacy of the vaccine. That was really helpful for me. Um, so all of those things kind of coupled together happened in a pretty fast timeline, because once I knew the vaccine would be available to me, I started doing, the research as quickly as I could just to make sure I had the information to move forward when I had the opportunity.
Great. And it sounds like there was a lot of, people allowing you to make the decision yourself, but a lot of support along the way. Did you encounter any opposition to your decision?
My family was they were not opposed, but there was a lot of questions about, oh, like, can you get it being pregnant? Is that a good idea? Are you sure? Just out of, I think, pure concern and making sure that I was making the right decision. My husband was very supportive and, definitely felt like it was the right thing for me to do. But, I had to kind of talk my family through what my reasoning was for getting it and why I felt like it was the right thing. So, yeah, I think that was sort of the biggest kind of, I guess it wasn't true opposition, but kind of pushback from my family.
Thank you. I think that is the reality and experience for most people, is that it's not just, all of the information pointing in one direction. I think there's a lot of different push and pull. So thanks for sharing that. Nikali, can you share a little bit about the research and your decision-making process?
Yes. So one of the biggest things that was really driving me to get the vaccine is not only for my overall health, but for the people around me. There is someone in my family who had a heart transplant. And so I want to do what I can to make sure he's safe. My grandparents are older and they have chronic illnesses, and I want to make sure I'm doing what I can to keep them safe. And then with Erie, with the LHL program, I oversee the HIV and case management program, where we're working with patients who are HIV positive who may have a number of chronic illnesses. And I want to make sure, again, that I'm doing everything that I can to keep them safe. And if it's one thing that I really noticed, especially within my family and with my social media, there were a lot of people of color who were incredibly hesitant about getting the vaccine, who still are incredibly hesitant to get the vaccine. And one thing that really stuck out to me is outside of work, I didn't see a lot of people who looked like me who were getting the vaccine. And the vaccine is so incredibly important for people who look like me because of the disparities that kind of exist in healthcare. And I wanted to be one of those people who got the vaccine so that people who look like me see someone who they know, who they trust, getting the vaccine. And hopefully I was able to persuade some people in that way. And one thing that I really did when I was kind of doing my research for the vaccine is not only using the information from Carell and her team, but also any news article that came across my social media about the vaccine. I was reading through it. What are they saying? What resources did they use? Whether it was like the Huffington Post or like the CDC, or like Hopkins Medical. Like, I was really reading through a lot of information just so I had all of the information that I needed that really contributed to me feeling comfortable with receiving the vaccine, and also passing along the information that I found helpful to other people to kind of make them feel more comfortable in getting the vaccine. And one thing that was really stressing to my family, to my friends throughout this process is I'm not here to tell you what to do. I really just want to encourage people to do their own research so that way when they make the decision from themselves, that they know exactly why. So that once you walk into an appointment and you make the decision to get the vaccine, you know exactly why you're there. Or if someone is making the decision not to, that you're making that decision from a place of research and science, and not necessarily from a place of fear. And I feel like that's incredibly tricky now because people are scared during the pandemic. People are scared to get COVID. People are scared of the vaccine. And really just kind of encouraging people to really not necessarily go based off of things that they may hear, because it's a lot of misinformation and it's a lot of things that aren't true floating around on the internet, but to really make that decision from a place of education. And also I find it important because even with one of the support groups that we had for one of our patients, with our patients yesterday, we not only talked about how COVID was impacting Black communities, but we also shared why we decided to get the vaccine, which is incredibly helpful to other people because I feel like they can read all of the articles and kind of hear all of the news coverage on the vaccine. But I feel like it's incredibly imperative for people to see people that look like them, giving them this information or also getting the vaccine. So I got it not only from myself, did the research not only for myself, but to also pass along what I learned to other people.
Nicole, I love that. I had a friend ask me, or she said, just tell me, should I get it? Yes or no? And really, it's so much more complicated than that. It's doing your own research. It's talking to your loved ones. It's really having to come to that decision yourself rather than, it's so much easier for someone to say, do it or don't do it. But really to be able to make that decision yourself is super important. Jim, I'll turn it over to you.
Thank you. Yeah, really great. Everyone had a really interesting and great process. And someone just mentioned in the chat, Nicole, just recognizing that a lot of people of color have distrust of medicine, of doctors, of science, because of, 402 or 3 years of white supremacy in this country, where medicine and science have not always served Black people well at all, and in fact has abused them and done terrible things to them. And it's not just historical, it's stuff that happens right up until this moment. So hearing from people who look like you, hearing from other people of color, I agree. I think the personal story, the personal aspect is so important. And the more folks can share their stories, I think the better. You're serving so many people doing that. There's another question that came up in the chat from Habiba, wondering about, Habiba, sorry, about the difference between your first, you all have been double dosed. So quickly, like what was the difference? What was the side effects like the first time? And what were the side effects like the second time? And let's see, why don't we start with Shira?
So for me, the side effects actually were not that different. After the first dose, my arm was very sore for 2 days. And I had a headache for maybe 3 hours. And then after my second dose, it was very similar. My headache lasted a little longer. I slept very poorly that night that I got it, which could or could not have been attributed to the vaccine. But personally, I didn't have some of the other side effects that a lot of my colleagues have reported having, as far as fever and other things. So for me, it was really a really sore arm, kind of a little bit fatigued, and just like a mild headache that I, took Tylenol for and felt fine.
Thanks. And Chayo in the chat reminded me to ask you all just to make clear which one you got, whether it was Pfizer or Moderna.
Moderna.
Okay. So if everyone could drop in, you probably all got Moderna, I'm going to guess, but just to be clear, so we all know, although they're the vaccines are using the same technology. Why don't we go to Carell?
After my first dose, I had a sore arm. I kept moving around. I was so excited about it. I didn't take any Tylenol because I was excited about it. And that was the only thing I had after my first dose. My second dose, I had a low-grade fever. It was 100 for a couple of hours. Was pretty fatigued. had some body aches and chills. I'm usually very cold, but I was wearing a blanket on top of all my layers. So that's how I knew I was a little cold. And then everything went away the next day and I worked out and felt back to full strength.
Excellent, thank you. Alex, I don't see you on camera, but if you are there, what was the difference between your first and second doses in terms of side effects? And maybe you stepped away, so we'll go to Nikale.
Yes, so I had more side effects after the second dose, but I feel like my side effects were more severe after the first one. So the first one, I had the arm pain that really kicked in maybe the day after, that lasted for a couple of days before going away. With the second dose, I still had the arm pain. There was some fatigue and a very light headache. But one thing that Karel said, which I think really helped a lot with the shoulder pain and kind of like on the injection site, is I was literally in the shower just doing these over and over again and just really kind of working like my arm, and that helped a ton. After the second dose, I had all of my, or one thing I do want to point out is that when it came to the first dose, I probably started having side effects the day after. When it came to the second dose, I was experiencing the side effects, the arm pain at least within the hour, but all of my symptoms resolved within 24 hours. But if anyone has like the pain on the injection side, I would just recommend throwing some shoulder rotations out there, which helped so much.
Thank you, and no worries, Alex. We know you're working and it's important to take care of your clients and patients. So thank you for taking care of them. But that question was, any differences, or what was it like the first dose and any side effects and compared to side effects that you may have experienced from the second dose?
Yeah, I kind of jot some so I would remember. So yeah, for the first dose, I felt like a little nauseous, slight headache, and slight body ache. So I definitely was feeling something. So I got that first one on my left arm, and then the second one I got on my right arm. Yeah, it was like on-site pain wherever either my left or the right. But then I was experiencing, like the on-site pain on both. Like I got my second dose on my right arm, and then I was feeling slightly pain on my left. It was just weird. But I definitely, I got it in the morning. It was like a Friday morning. And then by nighttime, I was already feeling like I had the flu kind of thing, where I was feeling feverish, chills, and big headache. But then I took some ibuprofens, and that subsided. Nausea. I was getting some night sweats for the next couple of nights afterwards. So
Did the side effects freak you out? Were you a little freaked out when you got them, or were you, if you had read up on them, were you kind of prepared for them to happen?
I didn't want to believe that I was gonna get because in theory I'm like, oh well, I got the first vaccine. I'm sure like my body's used to it and it recognizes it, so it shouldn't really affect me. But the second dose definitely freaked me out, and I was waiting to see what the ibuprofens were gonna do, and it helped.
Yeah, it's sort of funny, we know the vaccines are working when you kind of feel crappy like that. It means your immune system is getting amped up. So even when you're feeling really nasty, you kind of know that it's amping up your system.
This is Bridget. I just wanted to add, I was surprised at how bad my side effects were after the second dose. I think of myself as generally pretty healthy, and it kind of hit me all of a sudden 12 hours in. And kind of like Karel said earlier, I think for me, it was like, oh man, I feel really, really bad right now. And I know my body's really hard at work making these antibodies. And so I think people have had a real variety of side effects, from none at all to just a sore arm and kind of all over the board. And I think, to just go in prepared for whatever it might look like if you decide to get the vaccine yourself. It is more common to have those stronger side effects or just more side effects after the second dose for both Moderna and Pfizer.
Thank you for that. And for all of you, you've all had double doses. There was a follow-up question from Habiba. Did you all get it on schedule, or were there any delays? So if any of you had a delay, raise your hand and we'll hear from you. If you were on schedule, then we'll know that you don't have to ask further. So you were all basically on schedule? And I guess it's happening at work, so I guess that probably helps. But thank you for the question. And before I turn it back over to Bridget, I want to capture something from the chat from Sanford. And maybe you know this, Carell, because I don't know. We've been talking about being vaccinated does not necessarily stop you from becoming infected with COVID, even though it will reduce symptoms, reduce serious illness. Do we know of any data at the moment of people who have been vaccinated, have gotten a full vaccination, and have gone on to acquire COVID? Do we have any data on that you're aware of?
It's a great question, Jim. I don't have any data off the top of my fingers right now as to numbers or percentages in terms of our larger overall vaccination picture in the country. I can speak to, we did have 2 employees at Erie who contracted COVID after receiving their first dose of the vaccine. And they recovered from infection. They had fairly mild cases and then received their second dose of their vaccine on time. But I think this is a really great point to mention that no behavior should change after vaccination, even the 14 days after your second dose, when we expect those antibodies to be really in full swing and working to protect you. And this is because we need to wait until the rates of COVID-19 in the general population are very low. Today is day 14, I think, from my second dose. And I'm so excited. And I'm going to celebrate by doing everything that I've been doing this entire time and wearing my mask, washing my hands, keeping my distance until I know it's really safe to change those behaviors. And right now it is not.
Yay for herd immunity. That's what we need to get. We need about 85% of people vaccinated actually to get to that kind of community safety. But with that said, I'm going to turn it over to Bridget for some more questions.
Great. I think that was a wonderful segue into the next question, Carell. So 2 doses are all behind you. Side effects are all behind you. How do you feel now, having received both doses of the vaccine? Can we start with Alex?
I am kind of relieved. And I would honestly say I've kind of let my guard down a little bit. I'm just, I get to see more family members now. And that's all I really wanted, because even before the vaccine, I was not the most safe with distancing and so forth. But now it's like a relief, honestly. You'll be lying if you don't stress about like, oh my God, my throat, what is this? My head, like, any little seasonal allergy symptom, you automatically think that it's, COVID. But now I don't have that worry, thankfully.
Thank you, Alex. Nikale, how about you?
After receiving both doses, I think the word that really comes to mind about like how I feel after is just incredibly grateful. And I say this because I think one thing that kind of really hit me is that when I was going in for my second dose, I actually took an Uber because my car is not a winter car. It does not do well with snow. But I remember just riding in the Uber and I started talking to the Uber driver. He was talking about how one of his really close friends went back to his home country of Nigeria. And when he went back home, he contracted COVID-19 and unfortunately passed away. And for that driver, that was his determining factor for him getting the vaccine. That's when and he said in his own words, that's when everything was real to him. And so I think at that moment, as I was literally on my way to get my second dose, I was just incredibly grateful, not only for the access to the resources that I had that allowed me to make the decision, but the ability to really read and understand the research that was put out about the vaccine, and then just having the opportunity to even get the vaccine, especially as we see on the news, the long lines, the long waits for people signing up to get their vaccine. And so honestly, after receiving both doses, just kind of understanding the disparities that exist, especially in Chicago, just incredibly grateful.
So we have relief and grateful. How about you, Shira?
I'm sorry, can I just want to add, I'm also HIV positive, which was another concern of mine. But, you know, right now I feel great. Like, I tell my 65-year-old mom, like, hey, you know, I feel great. Unfortunately, she doesn't know my status. It's just a whole personal thing. But yeah, I encourage her to get it because, you know, if I'm like positive and then I feel fine, I think she'd be a good candidate.
Thanks for adding that in, Alex. I appreciate you sharing that with the group. Shira, what about you?
Yeah, I mean, definitely relief is a big feeling. I'm also at 14 days today, so it feels great. I also feel, I still feel like a lot of risk, knowing that I still have a lot of people in my life. I mean, I have a very small bubble, but I have a young son who's not going to get the vaccine anytime soon. My husband is probably not going to get it anytime soon. My mom was fortunate to get it. She's over 65, so she was, but I feel still at risk, I guess, even though I personally don't feel like I will get sick, knowing that I've been vaccinated. And so just I'm still feeling a little bit just worried that there hasn't been more ability for people to get the vaccine at a faster rate, that it's taking a long time, which isn't surprising, and I understand why. So yeah, I feel relief for my personal health, but I also feel a lot of I'm still being very, very, very cautious about my day-to-day life.
Thank you, Shira. And Karel, how about you?
I want to echo the words that were said by my fellow panelists and also add the word responsibility. There was so much buildup to our efforts, particularly for our Erie staff, to get our staff vaccinated, because so many of our staff come from the same communities that we serve as our patients. So being fully vaccinated and getting our staff fully vaccinated was such a huge relief and a huge effort, but we still all have so much responsibility to bring people along with us in this journey towards kicking COVID in the butt and being able to get back to what we would hope to be some semblance of normal. So for me, what that looks like is still putting vaccine messaging on my social media. Erie put on an Instagram Live that I co-hosted with another infection control team member, and it was a really vulnerable moment to do something like that that I've never done before, but it was also really liberating to feel that I was working with my organization to take social media back from this misinformation that's all over and use it as a way to give this information out to others. So I'm so glad I'm fully vaccinated. My mother is in 1B and is going to be vaccinated soon. She's a teacher, so that's, there's so many, I could go into the emotions around that, but the work is not even close to being done, and we are all responsible to be able to move this momentum forward and give the information to our communities, our patients, our loved ones, for all of us.
Thank you, Karel. And I will give 5 cheers to Erie on their social media. I've been watching you all on the Instagram, and it's really good. It's really clear. It's really helpful. And that it is so personal, and it just really job well done, all of you who are contributing to that at Erie. So woohoo! I'm gonna, as I teased in the chat, I'm gonna see if someone wants to ask a question live. Like, can we hear your voice? If not, we have more questions. But would someone like to ask a question live in our last several minutes?
Hello, everyone. My name is Sanford. I wanted to ask you all as panelists, first and foremost, thank you for being bold enough to put your face and yourselves out there. Thank you, AFC. Jim, you're always sparkling with something innovative. So here's my question. It seems as though you all have had evolving thoughts before you decided to take the vaccination. Are any of your biological or chosen family, within those realms, have you been able to discuss this, and have they changed their minds because of what you did by stepping up?
That is a great question. Who would like to start? How about Alex? Any changes? Your experience, has that changed the thoughts of anyone in your family or among your friends and colleagues?
My mom, she's definitely gonna get it now. She's scheduling her appointment soon. Yeah, almost everybody that I've told, as far as my family and friends, and close friends, yeah, when they get their chance to get it, they're most likely will get it.
Thank you, Alex. Let's go to Shira. You had talked about family being a little concerned about you taking it, and now that you've gone through this process, and has that impacted other folks in your family in terms of their own choices?
So I had several family members already get the vaccine as healthcare workers prior to me. So there was actually, I think, a lot of agreement that this was generally a good idea. I think they were just worried for my personal state. So I think if anything, I think the one person would probably be my mom and her husband, who, had heard of a few adverse reactions on the news and things like that. And I think just me getting it probably made them feel like, yes, this is definitely what we should be doing if you're doing this. So, and I know that, I've had other people tell me that they've shared my story with other people who in their lives who are expecting, and that it's been impactful for them. So that's more hearsay than personal family.
I'd put my money on the fact that those stories are impacting people. I'm going to put some money on the table and make that bet. I think the personal is so powerful, and you all proven that over and over today. Nicole, any of that, any changes or any thing you want to share from your family and friend perspective?
Yeah, so one of the biggest things, or first I should preface by saying there isn't anyone in my close friend or family group who can receive the vaccine right now. But I've been doing a lot of education and resource sharing on all of my social media. And I overheard someone in my family having a conversation with someone else about the vaccine based off a conversation that we heard. So while they may not have gotten it yet, I am wearing people down with information and I hear them passing information along to like their friend groups or their family groups. And so that really does make me happy. But if I do hear anything about people getting a vaccine, next grand round, you can catch me in the comment section.
Awesome. I love that. Yes, that's what it's about. And Carell, how about you?
I'm going to echo Nicole, and I can say I've been pretty relentless as well with my very close circles. But one thing that was fairly meaningful is I've been putting myself out there on social media to give this information and be a messenger and to funnel along. And I had someone who is a very, very far removed friend who messaged me and said, thank you for your posts. I read every single one of them. And that was the information that I brought with me to my vaccine appointment. I had not seen them in person. I had not talked to them in probably years. And I think it just goes to show how many layers of information sharing we all have and methods to give information. I talked to my mom before her vaccine appointment today. I talked to her last night, reminded her of the side effects and the plan and that this was a great thing. And I could hear the nerves in her voice, but I also knew that all this education that I've done with them impacts them, and they'll hopefully give it to others, as Nicole said. So that's really the thing, is to be relentless in giving people information and not telling them what to do, but so that we can all make informed choices. That's all we want to be able to do, is to make informed choices.
I love that, the sort of the relentless and perseverance. You don't have to hit them over the head and demand things, but I think you never give up, and remember that people have their own time frames, and some people can make choices quickly, and some people are going to really need to take time with this and really sit with it, and that's okay, and everything in between. But the relentlessness is around staying with it and not giving up and continuing to put out information and share your story. You all have been so inspiring to me today, and I really am grateful for you all joining us. We're at the end. I'm going to give Bridget the last word. I reached out to Bridget about this idea, and she responded, I think within seconds of the email was still wet when she got it. The ink was still wet on that email, and she was so excited about doing this. And I'm just really grateful for her partnership, and all of you for joining us from Erie, and everyone who came to listen today. Thank you so much. We will be sending out a link to the recording once the Zoom has done its thing. So stay tuned for that, and we'll keep you posted on upcoming grand rounds. And with that said, I'm going to give it to Bridget for our sayonara and our farewell words of wisdom.
Well, thanks, Jim. And I just have to echo your thanks to our panelists, to Nicole and Alex and Karel and Shira. I'm just so grateful for your partnership on this and for your authenticity and transparency in sharing your experiences. And I just want to offer to anyone who's still on, if you have additional questions, as questions come up, please feel free to email those to me. If they're for a specific panelist, I can connect you. My email is in the chat, but we are just happy to share our experiences. We hope you do your own research and keep going to webinars like this. And yeah, stick it out, everyone. We're in this together. So thank you again, and so grateful to your partnership, Jim.
Thanks, everyone. Enjoy the rest of your day, and we'll see you at another grand rounds very soon, hopefully on the 23rd. Ciao.
Thanks, Jim. Talk to you later.
Thanks so much, Bridget. You're a rock star.
You too. Bye.
Bye.